Quick question. Have you ever thought about health as something your bank account is quietly shaping? We're going to talk about it. Hey y'all, it's Dr. Lakeisha Watson, epidemiologist and data storyteller, translating data into public health insights for Black women. Welcome back to Epi Fridays. First things first, I know y'all see this tree. Mind your business, okay? All right, so my friends and I are always talking about wealth and financial literacy and what we grew up knowing and not knowing. And the public health person that I am started thinking about the link between wealth and health. And I was like, why not just do an Epi Fridays video on it? So today we're talking about wealth and how access to it or lack of it shapes health across the life course. So let's get into it. In epidemiology, we think about exposures, right? So things that increase or decrease risk over time. Wealth is one of those exposures. And research consistently shows that wealth is associated with longer life expectancy, lower mortality, better mental health, and reduced chronic disease risk, even when you account for education and income. Why? Because wealth creates protection, right? It allows people to live in safer housing, leave unhealthy jobs, access care, and recover from stress instead of holding on to it. But, and you may have heard this before, but wealth is not evenly distributed in the US. Black families, on average, hold far less wealth than white families, and that gap exists across income and education levels. This happened because wealth accumulation was systematically blocked through land denial, housing discrimination, exclusion from pensions and benefits, and repeated policies that allow Black assets to be devalued, destabilized, or taken. Now, this matters because wealth is cumulative, right? So when one generation is prevented from building wealth, the next inherits not just fewer resources, but more stress, more vulnerability, and fewer buffers against harm. And there's another layer here that matters. Research shows that even when Black families accumulate wealth, the health benefits aren't always equal, especially at lower wealth levels. So in other words, the same dollar amount doesn't always buy the same level of safety, stability, or health protection for Black families as it does for white families. And that is because of exposure to discrimination, environmental risk, and structural barriers continue. So the issue isn't just how much wealth exists, it's how systems allow wealth to function as protection for some, but not others. And here's where we need to widen the lens to something important and something incomplete. So Black families don't just build wealth through formal institutions. We participate in philanthropic giving. And when I say that, I don't mean billion-dollar foundations. I mean the way we pull money for graduations, weddings, baby showers, funerals. We know how to pull some money together. Those are informal capital transfers, and they are a real form of philanthropy. But let's be clear, most of these transfers are one time. They help someone move forward in a moment, but they don't really help build assets that compound over time. Historically, that wasn't by choice. So these practices developed because Black families were excluded from systems that turned money into lasting wealth. So this informal giving became about stabilization, not accumulation. And stabilization still matters, right? It reduces immediate risk, it prevents crisis, it protects health in the short term, but it rarely creates intergenerational protection. And lately I've been thinking about what would happen if the ways Black families already pull and circulate resources were allowed to compound instead of constantly being used to patch holes. And I want to be clear, this is something I'm still thinking through. I know there isn't one clean solution or one single model. It's not going to work for everyone and everywhere. But I think we can imagine shifts like collective funds that move from one-time gifts to shared asset ownership, or even community-based saving systems that are protected, matched, or subsidized. So in other words, the issue isn't that Black families don't know how to generate resources, is that systems have consistently redirected those resources towards survival instead of accumulation. All right, y'all, I know that was a lot of information, but I hope it gave you something to think about, and hopefully you'll be thinking about it with me now. But this is just the start of a bigger conversation. We will come back to it throughout the year, but if there is one thing to remember, it is this: wealth shapes health, not just individually, but across families, communities, and generations. All right, y'all, that is this week's Epi Fridays. I will see y'all next week. Bye.